Good morning, everybody. It's great to be here, and it's always a pleasure to come to Kathmandu University premises. And thank you for inviting me to this TED Talk. Today, I see a lot of medical students here. I would like to share my own journey to my professional career and a few initiatives that I think are very important to the people of Nepal that we're undertaking. And I'm also going to share with you the factors that shaped my own career. As you can see, I've done, long years and decades of work in this country after my training in a lot of different places. But this background of long experience started from a very humble background in Palpa, where there was no road access. We didn't have water at home. We had to go and pick it up in the pitcher, take care of the cattle that we had at home, and also go to the school. And this is how I spent, first several years, decade of my life. And I had no idea where am I going to be when I came from Palpa to Tansen to join in health assistance course, way back in 40 years or some ago. And a lot of things got shaped in my mind, as well as my determination to get a few things done in my professional life, were shaped by my mentors and teachers. And I had a luck of meeting some very positive teachers during my health assistance course. Somebody who had no idea whether or not I would become a doctor. A teacher comes and calls you up and says, "Oh, young man, you are good in class, and I think you should become a thoracic surgeon." And that kind of sparked a drive in my heart and mind. Oh, maybe that's something possible. I had no idea how to become a doctor by then. And that kind of continued to spark my enthusiasm and commitment. And then eventually I became a doctor. I went to Ukraine and then came back and somehow got to Bangladesh for post-graduation. And then went to US for further residency and fellowship, and then to Canada for pediatric heart surgical training. All that, I learned bits and pieces of skills, the quality, human qualities, leadership ability and quality in my teachers. And I think a lot of my skills and thought processes are shaped by those teachers, and I really want to thank those teachers that I had an opportunity to work with and learn. When I came back, after all those fairly advanced training in cardiac surgery, I almost didn't have a real work to do. I had a job at university, teaching hospital, but there's no real work to do because the setup wasn't ready for a cardiac surgical program. And it was quite frustrating to begin with. And that made me think, well, you need to set up with your own initiative an institution where you could potentially, do your professional job. And actually, that's how I agreed to take up the position of director of Syed Gangalal National Heart Center. At that time, in 2001, we started converting a shoe factory into a functioning heart hospital. And of course, there are a lot of challenges in setting things up and getting the programs done. But all this story I'm telling you to tell that my professional career was shaped more than any of the things that I said before by my patients during the course of my service. I have a lot of examples to quote here, which just tell you a few of them, which really changed my thinking process. I was trained. We finally got some setup done to be able to operate. There are thousands of patients waiting out there in the community with no access to care. Somehow they get to us. They have a disease. I have the skill. My team has the skill. But there's no means to pay for the service. Here, a professional who is committed and interested cannot help the patient who is right in front of you. That made us thinking, how do we change the situation? And that led to, big time advocacy from a national institute to with the politicians, with the senior bureaucrats, that we have to take care of the kids at least. If they need an operation, they should not be denied of treatment just because they don't have money. So we were able to make the children's heart surgery free in this country right since 2003 through our own politicians and bureaucrats. It's a very great positive experience that if you advocate for the right cause, the leadership generally supports you. That goes on and on to other programs, rheumatic heart disease, senior citizens, and all sorts of things. So I think we were able to at least get our patients through our treatment units and operating rooms and stuff like that. But that was not enough. I was sitting in my office in the front door of Syed Gangalal Heart Center, where the operations were carried out, and a lady very inconspicuous lady, came and sat right in the middle of our, front yard. And it was very unusual to see that scene. And I asked my assistant to go and ask, what happened with this lady? What does she need? It clearly doesn't look like a typical patient that comes to our hospital. So he came back and said, oh, she comes from Humla, far remote site. She wants to see Gangalal Koirala. Well, that was not my name. But it was very clear message that she didn't know how to navigate through the system. She didn't have money. Somebody actually helped her to get to Nepalgans from Humla and from Nepalgans to Kathmandu. Somebody sponsored that trip, had no idea how the treatment was going to happen. She actually needed a heart operation. We mobilized funds again. That time we didn't have all the schemes. We did the operation. Now she has no money to go back to her house. Her house was several days' walk from Nepalgans, Humla. That time there was no road. Even today, it's kind of difficult access. So, we did it. Next year, this lady comes back. We told her to go to Nepalgans for follow-up because it would be too far for her to come here. She comes back and said, oh, I came here for follow-up with you, doctor. She found out. And how did you come? You didn't have any resource to come back here. We had changed her valve, and she needed some medications for a long time. And she said, Pato bechikana aya ho. She sold her piece of land to be able to come back for follow-up. That struck us. Man, this is not what we wanted to do. It's not what we wanted to do. We fixed one problem, create another problem here. I mean, that kept, sparkling ideas. How do we decentralize this care out to the community rather than bringing every poor patient into Kathmandu? And that was the foundation basis for our initiative for Heart Lung Academy and decentralizing to all these different provinces. Well, this is the patient that hit on our head to think about how do we really change our practice. I got a lot of other examples. As I said, I was trained in one of the nicest and advanced pediatric institutions in Toronto. But then, when you come here, you got thousands of children who needed an operation. They didn't have money, as I said. We kind of created that system, operated. Now, after 20 years, 25 years of those early days, I go to any city in the country or outside, US or UK or elsewhere, I get to meet those kids who have now grown up, have become managers, professionals, PhD holders. And they come, a lot of times they come and say, hey, doc, you're the one who fixed my heart 20 years ago. And here I am. And that's what started, sparkling another enthusiasm and zeal in us. Oh, this is what we want to see. Giving a second chance to a child who otherwise wouldn't have that chance. I think these patients' kids really made me think, oh, this is something worthwhile doing. But there was a bad story attached to that. Not every child got through. And there were dozens of children out of these, decades of practice who otherwise could have been saved, but because of our lacunae in the system, in the lack of the comprehensive care, these kids could not be saved. And I feel guilty, bad, and helpless at times. These kids could have been saved. This is what started provoking thought in our minds. No. I think we need to change the way we take care of these kids. We need to have holistic programs that every disease can be taken care of under one umbrella. We didn't have that so far. We don't have that so far in Nepal. That made us think about having a Children's Institute and then working for life in the area of child health in Nepal. So I guess you're aware of some of the initiatives that we're taking. It all comes from our own experience working with our children and patients. I have some more experiences that make me really, really humbled. I operated on an adult patient a decade ago, or maybe more now. He was running around to get the treatment, and somehow he wasn't getting the right treatment. He came to me. I was in University Hospital that time. He had a bad coronary artery disease. We bypassed him, fixed him. And 3 months later, he went home. 3 months later, he called me up and said, "Doctor, I, worshipped, my God, whoever." I mean, I'm not going to tell that particularly, but, this is a person called Bhagawan who fixed me and saved me. I want to change my religion and become a Hindu. I said, "What? Why do you need to do that, man? Hold on a second. I called him on the phone and said, "Don't do that. Just remain who you are. Why don't you lead, a life which helps bring people together across religions? You don't need to change." That made me think how sensitive our profession is. You could easily twist his mind up and start playing around their spirits and their emotions. And refrain from those types of, blackmail when people are at really emotionally vulnerable. And there are so many other examples that have shaped my own life. And I can tell you that we don't need to be very intelligent people to do a good job. We just need to be honest and diligent. It's very relatively easy for all of us, doctors or healthcare professionals, to make a diagnosis, write a prescription, and hand the prescription over to the patient and, go to the next step. That doesn't seem to be enough. What differentiates a doctor from a good doctor, in my view, and I think a lot of other people have said it, is if you give 1 extra minute to think about what this patient is going to do after you hand over the prescription. Is there something that you could do to help his next step? I think that makes a huge difference. And that's the definition of a good doctor, successful doctor, is somebody who pays attention to the things that cause the problem and the consequences that a disease can bring to a patient's life. And somehow, we try to copy that, and that brings about a lot of other things that you advocate for. And it's well said in our medical practice that, a doctor is obligated to advocate for the cause of the poor, the patient, the weak, and the vulnerable. And that's what makes us a complete doctor. And sometimes I really feel good that we've been able to do some of the things here, a lot of things to be done, particularly in the area of child health, as I said before. But I really feel good that I was at least a small part of being a voice for those who don't have a voice. And you know that. Being a part of those who are helpless and have no means to pay for their own treatments, or at least in some ways or the other. And trying to be there closer to their houses through different mechanisms when they can't find you in this complicated world, coming to big complicated buildings and the hospital setups that we have. So at the end, I think our profession is noble. I feel great to be a physician. Our life hasn't been easy. We have compromised a lot in our personal lives. But again, for people to think about you as somebody who helped save their lives or reduce the suffering just feels great. I urge you all to think about it, give 1 extra minute beyond your prescriptions. Thank you very much.